I am excited that you decided to join us because we got a great show. You guys, September is a month of suicide awareness, and I have a fantastic guest that is going to be on with us. But before we get started, I just want to again welcome all of you to the You Didn't Get the Memo show. Tell you a little bit about what the show is, and it's about providing you, the viewer, with relevant, factual, mainstream information to help you be informed and to make informed decisions. I'm excited to share with you that You Didn't Get the Memo also is not only airing live on Facebook and YouTube, but we are also on LinkedIn. And as you guys know, we are all over the world. So, again, welcome. If you have questions, if you have comments, place them in the comment section. We'll do our very best to get a response or get back to you. And also, I want to remind you that today's show is being brought to you by the Lemonade Bar. Now, my guest, Dr. Ardis Martin, is a psychiatrist, and I want to tell you a little bit about Dr. Martin. First of all, she is Ardis Martin, MD, who is a board certified child, adolescent, and adult psychiatrist. She earned her BA degree in philosophy and psychology at Boston University and her Doctor of Medicine degree at Wright State University School of Medicine. Now, Dr. Martin enjoys speaking about the importance of mental health with the goal of reducing stigma, promoting prevention, and improving overall mental well-being. She also enjoys writing, lecturing, using music, literature, and film to teach about cultural issues in psychiatry, as well as the role that music can play in the treatment of children and adolescents. Maybe we can get her to talk a little bit about that. But I want to welcome to the show Dr. Martin. Thank you so much for joining me today.
Thank you. It's my pleasure. Thanks for having me on.
Oh, I'm excited and wanted to talk to you. With this being Suicide Awareness Month, I just thought that it was so imperative that we address and talk about this issue. So I want to just start with let's just jump in and start with, first of all, let's tell our viewers, what is suicide or what is a suicide attempt, please?
Yeah, so suicide is when someone takes their own life with conscious intent by lethal means. And lethal means typically the top three are firearms, suffocation, which includes hanging, and poisonings, which often includes overdoses. So someone who makes a suicide attempt is attempting to take their life, but luckily isn't successful. The danger with regards to suicide in general, we always have to watch for, especially with regards to mental health issues. And so that's why, especially this month, that's something that we are looking at very closely. And we are always excited to have people kind of be interested in learning more about it so that way we can prevent those things from occurring.
Yeah, absolutely. And, when we talk about suicide attempts, what are some warning signs that someone may be at immediate risk for attempting suicide? Because, one of the things that I have learned, people tend to always say, how you doing? And they say, oh, I'm doing good, or I'm okay, or I'm all right. And we tend to miss those tone inflections or, the way they say it or things. It's just something that I think should stand out. And I think a lot of times we're always so moving in society at the speed of light that we don't take the time to really recognize. And it's only after an event has occurred that people start to say, I should have noticed that. I should have known that. So tell our viewers, what are some warning signs that they may watch out for and kind of cue them in that someone may be at risk for attempting suicide?
Yeah, so first I want to say it's very difficult to predict, even for psychiatrists and psychologists, but we definitely have some risk factors and things that we look for to kind of help us kind of determine whether or not someone may be looking towards that and trying to get them, again, the help they need with regards to any kind of mental health treatment. One of the things that sometimes people will notice is that start making kind of suicidal statements, either kind of passive statements or active statements. People can say things like, I just wish I wasn't here. I wish, God would take me away. I wish I wouldn't wake up tomorrow. They kind of get very hopeless and helpless, especially around the hopelessness, this idea of as far as nothing matters, really feeling like, again, if so, there is nothing to look forward to tomorrow, things aren't going to get better. That mindset kind of gets ingrained to the point that, again, that hopelessness kind of makes it seem like, again, there's no other option. There's no point to me living. Some other warning signs that sometimes we will see is that a lot of times people will withdraw from their families and their friends and their community. Sometimes people will start giving things away. Sometimes people will give these kind of goodbyes that don't seem like the temporary normal, like, oh, see you later. It's like these in-depth kind of ways of saying goodbye to someone that can seem like off-putting, that people sometimes can kind of pick up on. Sometimes people will have increased alcohol or drug use. Sometimes their behaviors will change as far as like more erratic or aggressive behaviors, mood swings, impulsive behaviors. It's one of those things we definitely have to watch out as far as in the teen and adolescent population, just because impulsivity is kind of like part of who they are at that time based on brain development, but that also puts them at higher risk, for suicide attempts and for them to commit suicide. So we're always watching for those things. And I think the one thing that's as important is to make sure that, a lot of times we're told that we shouldn't ask someone if they're suicidal. That's a misconception, because people think that if I ask, that means that that's going to lead them or give them the idea or cause them to do that. But in actuality, it's something that's actually protective in the sense, again, it allows people to open up and be able to kind of like talk about what may be going on with them, so that they can get the help they need.
Right. And as we know that suicide does not discriminate. You said earlier, a lot of, there's not one clear path that you can identify, even as a psychiatrist or someone that's close to a loved one. But, and there doesn't seem to be one single cause. However, when we talk about some main risk factors, if we can talk about that and kind of level set when we look at dealing with someone who is thinking about or planning or, wants to commit suicide, are there some main risk factors that maybe people should be aware of?
Yeah, a lot of times when we do risk assessments, some of the things we're looking for is whether or not someone has, a family history of someone else that has suicided, whether or not someone has had a previous suicide attempt, especially with regards to if people have, mental health issues, because, we'd see higher cases of suicide in people that have, issues with regards to major depression, sometimes anxiety disorders, trauma, as far as PTSD, sometimes people with bipolar disorder, etc., schizophrenia. Like, so within the mental health community, as far as the disorders, increases in suicide are definitely possible. But we're also looking to make sure, as far as like, again, day-to-day things sometimes can become too overwhelming for people, where again they get that sense of kind of hopelessness that leads them to this as well. So watching for social isolation, people that have financial problems, legal problems, people that have severe physical illnesses, medical illnesses, that as far as like cancer or chronic diseases, sometimes that is another risk factor with regards to suicide. Substance use, as far as overdosing, especially, is one of the big factors. With regards to the teen and child and adolescent population, another big issue is bullying. Kids getting bullied, with cyberbullying. A lot of times, kids will be, told through the chat, like, why don't you just go kill yourself. So all these things definitely can come into play. We also look as far as like just the barriers that people have to getting mental health care is a risk factor. Sometimes, as far as cultural and religiously, there can be beliefs as if it's a suicide could be a noble resolution to a personal problem. One of the protective factors, and when people with their religious or cultural beliefs kind of like are against suicide. We also have to worry about, as far as especially in teen and child adolescent populations, as far as suicides that can occur in clusters. Now, like I said, it's important to be open and ask people if you're concerned about them, if that's a possible risk for them, that they may be considering that. But we also notice that when there have been communities where kids have committed suicide, that sometimes that can occur in clusters where there could be other teens that can do that within that community. Another big piece is just the idea of just the stigma, unfortunately, that we have with regards to mental health. And the whole idea that it's embarrassing or it's a wrong thing to have any kind of mental health issues, and so that stigma prevents people from again seeking help, and then can lead to people suiciding.
Yeah, you touched on so many different things there, and and I will tell you, I may flip and go back to some of those, but it's really interesting. You talked about one thing that stands out for me coming from the South, being a Southern woman and raised in the stigma, especially in a church family, and that stigma around, and how families don't want to deal with someone that what we would say seems to be a little off, right? Whether it's how they process things or how they receive things, but yet, it's a no. You don't go to see someone. And I don't know in your practice or how you or how one gets around that, because sometimes people know that they need help, but they are so afraid of being stigmatized as somebody, girl, you don't need no help, because let me just say, and no offense to any Christians or anybody out there, but a lot of times, a lot of the belief is, you'll get healed through the Bible. And so I don't know what your thoughts are on that, but I personally believe that we need to really look at all modalities that are available. And with that, my next question that I have for you is, what treatments or therapies are available for treating someone who may be at risk for suicide?
Yeah, so the main thing is trying to figure out as far as what particular mental illness or mental health disorder they may be suffering from that's leading them to have those thoughts of suicide.
Mhm.
So, the predominant one that we look for is depression or major depression in particular. But again, sometimes this can exist when people have their bipolar disorder that's not under good control. People that have schizophrenia can have suicide attempts as well, and can suicide. So, first thing we do is trying to find out as far as what the underlying cause is, what the underlying disorder is. So, for example, with regards to major depression, then the treatments that we often use are psychopharmacological, with regards to medications. And so we have classes of antidepressants, which the term of antidepressant is difficult these days because again it's a class of which it treats depression, but they can also be used to treat anxiety, etc. So we kind of classify them more as far as like what their components are. And so with regards to depression, we know that with regards to the neurotransmitters that we see within the brain that seem to be helpful for that are typically serotonin, norepinephrine, and dopamine. So we have the different classes of those medications. So we have SSRIs, which are selective serotonin reuptake inhibitors. We have SNRIs, or selective norepinephrine reuptake inhibitors, which also have some serotonin in them as well. And then we have additional kind of different classes of medication that can hit some dopamine receptors as well. So a lot of times it's, medication is first line treatment, especially when there is moderate to severe depression, especially if there's any kind of thoughts of suicide. And often we would like to pair that, because we think the best treatment is medications, but also having therapy as well. Because the biggest part with regards to mental health and the idea of mental illness a lot of time comes from the fact that our thoughts, our feelings, our behaviors are something that's disrupted that's causing us to feel these different ways. We know there's all these different reasons for why people become depressed, with whether or not there's genetic reasons, trauma, etc. But being able to do therapy can sometimes be helpful in helping people kind of get a better understanding about how they're thinking, how they're feeling, and how that impacts their behavior. So there's different forms of therapy. There's cognitive behavioral therapy, or CBT, which really looks very distinctly at, again, your thoughts, your feelings, and how they affect your behavior. There's dialectical behavior therapy, which is something that also kind of looks at, again, those ways that our emotions can get, away from us and kind of cause, in this area, especially, we worry about as far as it causing self-injury, where people aren't attempting to suicide, but are injuring themselves by cutting, burning, etc. There's ACT, or acceptance and commitment therapy, which is another therapy that has been used to help people understand as far as underlying issues around depression, anxiety, and kind of learning ways to kind of manage their thoughts and their emotions. Because a lot of times the thoughts continue to kind of like overwhelm us. Our thoughts, something can happen, and then our thoughts can kind of like make us feel even worse. I can feel sad, but if my thoughts are telling me that I'm a terrible person, I'm never going to amount to anything, again, those things get amplified. And therapy is very, very useful and a great modality in combination with medications to help us learn how to manage those thoughts. And so that we can get better in control of those things. And then we have additionally interpersonal therapy and psychodynamic therapy too.
Yeah, absolutely. Well, Dr. Martin, we're going to pause for the cause. Always have to pay those bills. And I'm going to allow you to just kind of think on this. This particular question when we come back is, when we think about it, what symptoms should prompt a person to seek professional help? So you guys, I want to thank you so much for hanging in here. We'll be right back. You are watching the You Didn't Get the Memo show with my awesome guest, Dr. Ardis Martin. We will be right back.
Whether it's advice on managing your anxiety or tools to help you stay grounded, Coping-19 provides a range of resources and self-care tips to help you cope with this pandemic. We can help. Find the resources that work best for you at coping-19.org.
Let's get back to talking smack with the side of mac and cheese.
Before we can safely come together, we need the facts on COVID-19 vaccines.
To get the facts, visit getvaccineanswers.org so you can make an informed decision when vaccines are available to you.
All right. If you're just tuning in, listen, you've already missed a good chunk of the show. Dr. Martin is just dynamic and really talking about, and we're expounding because September is Suicide Awareness Month, and we're talking about, suicide and suicide attempts and modalities and treatment therapies that are available to help someone. Before we went to break, I posed this question to Dr. Martin, and I asked her, what symptoms should prompt a person to seek professional help? So, Dr. Martin, I'm giving the floor to you.
Thank you. So I think it's always an interesting thing because, again, there are different issues that we can all have. So we can all feel symptoms of sadness. We can all feel symptoms of anxiety, and just different ways of just emotional states, or as far as how our emotions can get the best of us. But typically those things will be temporary and not long lasting. I think the biggest issue that we have is when those symptoms, become prolonged and start impacting your functioning. So with regards to psychiatry, when we make a decision with regards to diagnosing someone with a mental health disorder and then deciding on treatment, we're really looking at the impact that the symptoms that people are having on their overall life. So is it impairing their ability to, relate in social situations with their family and their friends? Is it impacting their ability to go to work or do their job as they have been in the past, but now are having more problems? So when it's definitely impacting functioning, that's when we start looking towards whether or not they meet criteria for a mental health disorder. And the symptoms vary depending on what the disorder is. So we'll have symptoms that are associated with depression, which can be some different than symptoms that are associated with anxiety, bipolar disorder, etc.
Okay. The bottom line is, if you feel like you've got a symptom or something that has appeared, it's not to put it off or to ignore it, because I can only see it just, being exacerbated by, it could be triggered by one little thing. And, everything is just kind of totally out of whack. So thank you so much for that. But let me just ask you this, or let me just say this. We're going to switch gears for a moment. Let's also talk about mental illness, because you brought that in. So when we think about mental illness, give us an idea, in your opinion, what is mental illness and what does it take to take care of your mental health?
Yeah, so the APA defines it as health conditions that involve changes in your emotions, your thinking, or your behavior, and that those things are associated with distress or problems in functioning, like we talked about before, that impact your social, work, or family kind of activities or engagements. So, again, it's that whole idea of like really looking at thoughts, feelings, and behaviors and how those are connected as far as like our daily functioning. So mental health, right, which we're trying to kind of keep that as positive, is like trying to make sure that, emotionally, psychologically, and socially, our well-being is in a positive light. So that way, if we are able to kind of manage the way that our thoughts are, our emotions are, and how we behave, then we're able to manage the stress of day-to-day life. So when things happen, we were able to cope in a positive way against any kind of adversity we have. And again, that fluctuates for everyone. Again, this whole idea that there's this one way to be mentally healthy, I think is difficult, because again, it's hard for on a day-to-day basis. Like, I'm sure like my mood fluctuates, everyone's mood fluctuates, but we're really kind of looking as far as this idea of being mentally healthy, that way that you're on a day-to-day basis being able to manage things as best you can without, again, having this kind of negative impact on your day-to-day functioning or your life that is so detrimental that it causes a lot of negative kind of outcomes in how you're living. So like, again, this whole idea of like healthy well-being, as far as like making sure that you are able to kind of like manage your emotions, manage your thinking, and manage your behaviors in this idea of a healthy way.
Right. So in my opinion, it appears that mental illness is not discriminatory, right? But is there a particular age group that mental illness seems to appear?
Yeah, and so especially with maybe child adolescent psychiatrists as well, we know that mental illness, as you said, does not discriminate, and actually can come at very young ages, depending on the illness itself. So within the child population, we definitely can still see depression presenting at that time. We see a lot of times, whether or not kids have been, neglected or been abused or any kind of trauma, so they can present with symptoms of, post-traumatic stress disorder at a young age. We definitely notice, as far as like the attention deficit, hyperactivity disorder, ADHD, that definitely presents in children and adolescents, so that then can continue on into adulthood. There are anxiety disorders that can present in children, as far as separation anxiety disorder. We can get generalized anxiety disorders, and adolescents and adults can also get generalized anxiety and social anxiety disorders. So again, it can go across the lifespan. The one thing that we also know is that sometimes with regards to when we're younger, men and women are kind of equal with regards to their presentation of depression and anxiety. But definitely once puberty hits, girls and women definitely have more prominent presentations with regards to depression and anxiety compared to men. So that's one of those kind of factors that come out based on sex. And the other thing that we watch out for, as far as, again, genetic predisposition. So sometimes if there's a family member that has a history of depression and anxiety, then sometimes presentation in their children may be even younger than they may have experienced it first themselves. So again, like, it definitely is something that's across the lifespan, does not discriminate, can present at all these different times and all these different factors that kind of come together to kind of like sometimes make it come to the forefront. So some people can have a predisposition and then have this kind of traumatic event occur that then kind of causes the symptoms to present at that time. And the main thing is like an understanding and knowing that mental health issues, they're definitely treatable. And that's the importance of like making sure, like, if you are noticing those symptoms, to get help so that we can get things back on track, so that way you can start living your life the way you were before.
Yeah, absolutely. Thank you for seeing that. And you just touched on something that brought up another question for me, because with COVID-19, with the pandemic that's been going on, you've got people who are dealing with grief, and I would love for you to differentiate between grief versus depression, because it seems like people are just kind of, everything is just kind of rolled into one and morphed into this, this big cloud. So can you differentiate for our viewers the difference between grief versus someone that's in a depression, a deep depressive state?
Yeah, and that can always be difficult for people to kind of completely understand, because one thing is, the biggest differentiation that we have is that grief is something that's triggered by loss, and that people will go through different stages of grief, and of which one of those is people can be very depressed, or people can have episodes of anger during that time, and that can persist and kind of come and go for as long as it has to for that person, because everyone grieves at their own speed, own time, own way. The difference with regards to depression is, again, it's something that it presents and definitely has this overwhelming kind of impact on your overall mental health and state, again, and having that great disruption with regards to how it impacts your social work and kind of peer kind of relationships. So, we have as far as major depression, which presents, and again, that's like a longer period of time where people can have a significant amount of symptoms, and then people can have like mild depression or unspecified depression that doesn't meet the same criteria of major depression, and then people can have persistent pervasive depression, which used to be called dysthymia as well. So there's different presentations for that, and I guess the biggest thing is the difference between with grief and loss, something happens because of a loss that can lead to those symptoms of sadness or depression or anger. But again, it's usually related to that specific situation or trigger. Whereas depression, sometimes it can be triggered by something, but again, the prolonged kind of episodes that it presents with and the additional symptoms that come with it are very different from what you see in just in grief. Now, you can get complicated grief reactions, which are prolonged, and then we're always watching to make sure that it doesn't turn into a major depressive disorder.
Okay, we're going to pause for the cause real quickly here. And when we come back, let's talk about the many different forms that mental illness can take on and discuss what some of those more prevalent forms are. So guys, if you've been tuned in, you are tuned in to the You Didn't Get the Memo show with me, Gloria Bailey Ridge, your host, and my awesome guest, Dr. Ardis Martin. Hey guys, don't go anywhere. We'll be right back.
Listen, you're my friend.
I noticed you haven't really been yourself recently.
Yeah, I feel like something's up.
How are you?
Are you okay?
Is there anything you want to talk about?
I just want to know how you're feeling.
And listen, even if you don't know what to say, I'm here to talk.
No matter what you're going through,
I just want you to know I'm here.
I've got your back.
when you want to talk, I'm here.
All right. Thank you guys so much for hanging in here. I have my awesome guest, Dr. Ardis Martin, who's a psychiatrist, and we are in honor of Suicide Awareness Month in September, but we're also talking about mental health issues. And before we went to break, one of the questions that I posed to Dr. Martin was, what are some of the forms that mental illness can just appear in? Because, you know, and maybe what are the more prevalent forms that she actually sees? So that was what we left on the table. So Dr. Martin, what are your thoughts in regards to that?
Yeah, so I think as far as prevalence, I think the top illnesses that I see, which basically would be either in the child adolescent realm or even in the adult realm, are major depression or the depressive disorders, anxiety disorders, ADHD in children and adolescents, and that sometimes can kind of progress into adult as well, and as well as bipolar disorder are probably the most common things that present. Sometimes I can still see symptoms of people presenting with obsessive compulsive disorder, PTSD, and eating disorders as well. Rarely do I have kids that or adults with schizophrenia, but that it can sometimes depend on where you're treating as well. Because sometimes they're seen more in community mental health centers versus in private offices, and sometimes seen more so in inpatient settings as well. And there's often the co-occurring issues with regards to any of those illnesses, with regards to substance and alcohol use, sometimes can kind of be dual diagnosed issues as well.
Right, absolutely. You touched on something in what's going on around the world with, with just some of the world events. But when we talk about PTSD, sometimes, it tends to just still kind of be overlooked. People don't deal with that. And I don't know how much of that you see in your practice, treating people with post-traumatic stress disorder, but just from the reading and the literature, it's very, very real and can be brought on by several different events as well. So any thoughts or additional thoughts in regards to that?
Yeah, I mean, I think the one thing is that, people can sometimes dismiss as far as the things that can cause any kind of trauma, because we get the classic things as far as like, child abuse or sexual assault. But any kind of grave violence, any kind of like disruptive thing as far as like, natural disasters, hurricanes, earthquakes, it's anything as far as, again, where, something unexpected happens that is, definitely outside the realm of normalcy as far as like the impact it's having on your ability to kind of cope and deal with the world. Bad things happening in general can definitely lead to some traumatic type symptoms. And we're always looking to see whether or not that's going to be something that's going to be acute stress or if it's going to progress to be a post-traumatic stress disorder. I think as far as, especially within the African-American population and people of color, understanding, again, trauma that exists generationally as well, as far as like things that came from, the past with regards to slavery, the racial trauma that happens today, the continued issues around microaggressions and perceived discrimination. Those things definitely can still continue to kind of cause these issues around trauma, which, can affect us, greatly as far as disrupting our sleep, our ability to concentrate, our sense of emotional feeling, feeling numb, and just kind of like causing a lot of distress and anxiety that can definitely make it difficult for us to kind of function on a daily basis. So it's important to kind of see as far as like, especially with this past year and a half of, people, dying in mass amounts all over the world, mass deaths within families. Those are traumatic events that we definitely need to make sure that we're looking at and not dismissing, because people are suffering from those issues.
Yeah, absolutely. And like you said, let's not forget, all of the other issues that go into, especially for people of color, that, it's almost like it's the pile on, and more of that. So those of you, my viewers, you're listening, listen, let's be aware, have an awareness. Dr. Martin, depression may sometimes go undiagnosed or misdiagnosed in older adults. So can we talk about some of the symptoms that family members or friends should be aware of, and especially older adults? I see that, and I think that a lot of times it may be missed and people don't understand, what that might look like. So can you speak to that, please?
Yeah. So, people can still present with the same symptoms, but I think the difficulty is that a lot of times we think of the elder, like, again, they're slowing down, they're like thinking about things in a different way, they're looking back in their lives, and that it's normal for them to possibly kind of be sad about losses that they've had, etc. But the difference is a lot of times they may not actually express themselves as feeling depressed or sad. A lot of times they'll express like this kind of feeling of numbness. The one thing that is important in regards to depression in general, but especially within the elderly population, is really looking at the degree of interest that they're having in their lives. If we're seeing a drastic decrease in their interest, the things that they normally would enjoy, I think that's a big warning sign to make sure that they're not actually, possibly slipping into a depressive state or even meeting criteria for a depressive disorder. Because when people have anhedonia, or this kind of like this total loss of interest and not able to have enjoyment of their day-to-day activities, that's a true sign of a mood issue that's arising. So we have to be careful and kind of be, as in tune as we can be with our elderly as far as like how they're functioning. If they're used to like knitting, going out and hanging out with their friends, even if they're small things, but all of a sudden they just don't care anymore or just not getting the same enjoyment out of it, then that's something, one of those things where you have to look as far as whether or not this is them entering into a depressive state.
Absolutely. And I think that for me, as an older adult, I want to underscore, I think that it's really important that family members realize the importance of just spending time, making that phone call, even more importantly, to just drop by if you can. I mean, now we have so many ways of staying connected with people, whether it's FaceTime, whether it's Zoom, where, whatever those different modalities are, you're able to do that. And let's not, just kind of what I would say foo-foo it away and not think that it's important. I know everybody thinks that they have very important lives, but I do think that it is important that people pay attention. And that's what we're trying to get across today is the importance of paying attention. Be aware. I think the word is be woke. You guys need to be woke and aware of what's actually happening. So thank you for that. But you know what? There are certain people that are still at higher risk for developing depression. An example, when I think about that, you touched on it a little bit earlier, but I want to go back to some of the youth, the young adults, right? Because social media plays such a huge role in these young people's lives. I have to admit, I'm blown away when I even look at things on now the latest thing of TikTok that people are doing. And I'm thinking, wow, are impacting. And as you said earlier on in the show, how people say, why don't you just go kill yourself? Or that bullying that's happening. You're so fat, you need to kill yourself. Those kinds of things. So when we think about that, is there, and I guess what I'm getting to, there has to be more of a specific age group. I don't know if it's the young teens or because it seems like that age group 10 to 12, now you're seeing a lot more of things happening as opposed to even those that are 15 to that 17 age group. So what are your thoughts? I've said a lot of things in there, but essentially coming back to what groups of people are probably at greater risk for developing depression or being socially isolated in your opinion?
Yeah, especially when it comes to social media. There are definitely positives to social media for kids and adolescents because sometimes it can increase their ability to kind of socialize and provide entertainment and provide this sense of self-expression. But especially with regards to children and adolescents, because again, the amount of time that young kids, 5 and up, are spending on these different kind of modalities, whether that be computers, laptops, iPads, etc., is a lot. There's a lot of hours that are spent using a device of some kind. And that's where the danger comes in. So, especially with regards to children and adolescents, particularly as far as middle school age kids, especially around the idea of the importance of peers being so important to them, that becomes even more of an issue because again, kids are at more risk with regards to again the idea of the bullying and trying to submit to peer pressure or try to avoid peer pressure, trying to kind of become their own person, their own identity. But often, especially with regards to social media, they're pulled into looking at these unrealistic views of other people's lives that they compare to their own. And of course, it's always lacking, which then leads them to have more self-doubt, body image insecurity, like you're talking about, kids calling each other names in yet another arena, causing them to have low self-esteem and then leading to those issues of depression, because then it leads to more isolation actually, right? Because again, you can't even, escape those things in that realm. Especially with regards to bullying in children and adolescents, and sometimes that can go as young as even kids in kindergarten and from kindergarten and forward, is prevalent because again, unfortunately, kids will kind of find these differences amongst each other, and sometimes different kids will kind of feed off of that, and can say and do very hurtful things, and certain kids definitely can have difficulty handling that. That can lead to them again getting depressed, and the bullying sometimes leading to suicide.
Yeah, and that is so unfortunate. If I had a magic wand to wave it and make sure that the kids all just had a healthy sense of self, and bolster their self-esteem, parents, that's why it's important to tell your children that they're beautiful and they're smart and that you love them, and rather than tearing them down, because there's so much the kids probably hold within and they don't tell their parents and what's going on. So that's why as a parent or a grandparent, you really need to be connected. So I'm speaking from personal experience. So I make sure that I say those things. But you know what, Dr. Martin, you talked about when we were talking about suicide and treatment modalities that were available. What about for treating just depression? Is there a psychopharmacological way of treating depression, or is there some kind of psychotherapeutic intervention, or do they all kind of fall within that same realm as you were speaking of when we were talking about suicide and suicide attempts?
Yeah, so it still comes down to the kind of areas, basically two areas that we look at as far as psychopharmacologically, we kind of look at things as far as medications. Sometimes depending on the severity of the depression, especially if it's treatment resistant depression, that they're not responding to medications. Sometimes we have non-pharmacological kind of treatments, electroconvulsive therapy or ECT. We also have transcranial magnetic stimulation or TMS, which is another treatment for depression. Sometimes people are very reticent to take medications or to use these other kind of treatment modalities. So a lot of times they will seek out treatments in other ways with regards to alternative treatments as far as supplements that sometimes people can get over the counter. St. John's wort is one of the medications that sometimes people, or one of the supplements people can use to treat depression. SAMI or S-andenosyl methionine is another. Omega-3 fatty acids sometimes have been used. So there have been studies for alternative treatments as well, so especially for people that don't want to take pharmacological medications. So there's also other modalities like neurofeedback, which is another form of therapy that sometimes people can find helpful for treating depression, anxiety, sometimes ADHD. But again, for us, the primary things that we look at are medications, and then therapy. And for depression, as far as candid, it really depends. As far as talking to each person, everyone can have depression, but they are going to present differently because everyone is coming from a different space. And then trying to assess what is the best modality for them with regards to the therapeutic realm. And again, like I said, sometimes the most common and very well tested is cognitive behavioral therapy and dialectical therapy, behavior therapy, and acceptance and commitment therapy. And then, like I said, interpersonal and psychodynamic are additional ones that we use as well.
Okay, awesome. Now, we're going to take a quick break, but when we come back, I'm going to ask you, although this is a big, it's the big kahuna, I want to talk just a little bit and have you touch on a study that the Department of Health and Human Services recently submitted this report, and we want to talk about why Black children are dying in that 5 to 12 year age range. And although, like I said, I know it's big, but I just like to have you just kind of touch on it and why it's important that we pay attention to, this information that's coming out, because it is critical and it's affecting our Black and brown children. So guys, don't go anywhere. We'll be right back.
Thank you for watching the You Didn't Get the Memo show with your inspirational host, Gloria Bailey Ray. It's your contributions that make this happen. To become a sponsor, send an email to youdidn'tgetthememo@gmail. That's the letter U, didn't get the memo. If you're not in a space to be a sponsor, but you like what you hear, we simply ask that you support what you like by making a contribution to the show. There are 3 ways to make an online donation. Visit paypal.me/Gloria Bailey Ray or Cash App or Venmo, Gloria Bailey Ray. Give what you can. Your support is appreciated.
All right. Again, I want to thank you guys so much for hanging in here with my awesome guest, Dr. Ardis Martin, who is a psychiatrist, and we are talking about suicide awareness as well as mental health awareness. Before we went to break, I posed a question to Dr. Martin to just kind of talk about, there was a study recently Congress convened and asked the Department of Human and Health Services to submit a report examining reasons for why Black children ages 5, get this, you guys, 5 to 12 are dying by suicide at nearly twice the rate of their white counterparts. And this study was conducted through October 2020, I think it was when it was released. And so, Dr. Martin, what are your thoughts on that? Because I have to tell you, as I was reading the report, and it just brought tears to my eyes. I was just mortified to think about a 5-year-old, even a 5, 10, anyone, but they hadn't even touched the pinnacle of living life and they're committing suicide. So what are your thoughts in regards to that particular study?
Yeah, that's something that's definitely come up over the past several years. The rate of suicide across the board with regards to children and adolescents has increased. Between 15 and 24, it's always been the third leading cause of death. And now, among younger teens and as low as the 5 to 11 age range, is now the second leading cause of death, especially among Black children. And it's their third leading cause of overall among children 15 to 19. So, the question is like, why are we seeing this more? Like, is it been happening and we just weren't aware? And I think that's part of the issue. But it's like the stressors of life that are like impacting these young kids and their families is playing a big role. And unfortunately, this also comes down to unfortunately the health disparities that exist in medicine in general and definitely within mental health care. We don't have the same number of children and adolescents that are getting access to healthcare as their white counterparts, whether that be because of insurance, whether that's because of cost of care itself, whether it's also big issues like limited providers. I think a lot of times limited providers in general, but also limited providers of color also play a big role. The unfortunate part as far as like the shame around seeking help, which, it definitely can be a cultural issue that we touched on before. The idea as far as like, well, we'll pray about it, yes, and I'm all about faith and praying. But I also think that, God put me on this earth so that I could provide this for people. And he wants people to kind of like seek that out so that way they can be healthy and prevent these type of things from happening. The other issues, again, we have, especially people of color, this, mistrust of the mental health system, because unfortunately we have been, abused and used without our consent for long periods of time, and so that mistrust also prevents people from seeking help. But I guess also as far as within the community, especially people of color, just the addition to the stigma is just the idea that we've been through a lot, especially people of color and African American descent, people have been through a lot and survived. And so when, these things occur, they're like, oh, I should get over it. It's not that big of a deal. But again, like this idea, the Superman, superhuman kind of superwoman type of thought process is something that's getting us in big trouble. And again, that if we're not seeking that care for ourselves, we're definitely not seeking that care for our kids. We're not being able to see that they are struggling. And that they need to kind of be seen and be able to talk to someone about the experiences they're having. Because unfortunately, they're still also having the issues around the racial discrimination at schools. We know that with regards to, the bullying that still occurs, that's still happening at young ages for kids, and people of color, young boys and young girls are experiencing that. Young African American boys are, and sometimes girls are more likely to be seen as a disruptive behavior issue versus having a emotional issue in schools that they're acting out, which is different than how their white counterparts are treated, which means, again, their white counterparts are more likely to get treatment versus any kind of discipline or, things leading to the legal kind of space. So again, all those things I think definitely play a big role in how we're seeing this increase in that behavior, which is just terrifying because, again, that's a population that is precious that we need to protect. And we're missing that. So we're trying to, as far as like the study is putting out, and they're trying to like get more on board with regards to, again, combating the health disparities, getting more people of color that are able to provide treatment, trying to meet people where they're at, whether that means we go out to the schools, we go out to people's churches, et cetera, to kind of like be able to kind of help them understand that this is important and dire at this point to kind of make sure that we're keeping our kids healthy and safe.
Yeah. Oh, absolutely. Like I said, it was very distressing to me to know that we have young children who are dying so young, and we've got to figure out why that is. And you just touched on a whole host of things that if you are a person of color, that you're dealing with totally outside of the realm of maybe what your white counterpart or colleague is dealing with. And so, America, we need to get this right. We need to get this right. There's no question about it. And so I say to you, Dr. Martin, thank you for all that you do to try to help and to continue to bring this to the forefront. Let me just ask you this. What does self-care look like in your opinion? Because it looks different for everyone, and we hear that word self-care, but in the realm and in the context of what we're talking about today, this being Suicide Awareness Month, and we're also talking about mental health, what does self-care look like in your opinion?
Yeah, so I think the part of self-care is something that's ideally something that's going to be helpful with regards to managing sometimes even mental health issues that people have or preventing them from developing those mental health issues. So self-care meaning, again, the idea of like in making sure you are kind of like addressing the basic needs that we often take for granted. I think over this past year, we really saw how much we took that for granted and the negative kind of outcomes of that with regards to, again, we're stuck inside for a year and a half. We're not going out. So our sleep is totally disrupted. We're not exercising. We're not eating well. Those are things that are like just the basics of what we need to get back on track on. Make sure that we're getting our 8 hours of sleep. Make sure we're working out, several times a week, and make sure we're trying to eat as well as we can, because those things have been proven to actually improve mood and, help treat depression, anxiety, like, different foods that we eat, what we put in definitely is important. And same thing as far as exercise. Again, those things have been proven to treat, if you don't want to take medications, then exercise can treat depression and reduce anxiety. Those things that definitely can be helpful. So like, it's an approach where, again, you're trying to put as much forward in a positive way as you can, that's necessary to kind of keep you moving forward. And I think the biggest thing that is most important with regards to self-care is really this idea of being mindful. This importance of like kind of being able to kind of like just be for even 5 minutes a day, because the biggest issue that I see with regards to most children, adolescents, and adults is a lot of times when we're thinking, the way their mood is impacted based on one, triggers, but also based on, again, the thinking, which we talked about, that thoughts, feelings, and behaviors and how that kind of all pans out. But a lot of times our thoughts are things that we can actually manage or kind of do something with, so that way we can have a positive impact on the way that we're thinking, and the shift in the thinking then have an impact on how we feel and how we behave. So we don't get into those negative states of mood and negative states of behaviors. Because oftentimes when we think about things, if we're thinking about things in the past or things in the future, we can't do anything about either one. Like, the past is already written and the future is yet to be written. We can't do anything. But if we're thinking about those things, it causes us so much distress and makes us feel in these negative, terrible ways. If we can try to be in the moment, because the moment is the only thing we can do anything about. Like right now, I can do something. I may not feel happy in that moment. That's okay. But I can do something about that. But I can't do anything about the other spaces that our brains are really good at and quickly going to. Right. So trying to be as mindful as you can, and whether that's journaling, that's meditation, that's prayer, whatever it takes to take that time to just be for yourself and to kind of be in the moment as best you can.
Yeah, absolutely. Listening to you say that, it just brought up one of the topics on my podcast was, are you resilient? Or are you resistant? And resiliency doesn't mean that things doesn't happen and come upon you, but we all have stuff, but are you resilient? Meaning just those things that you're just talking about. You are aware and you embrace whatever it is, and you just keep it moving. It's all called a part of life. So I appreciate that. So, Dr. Martin, we have spent some time together, and I have thoroughly loved this, and I'm going to put this out there. We got to have you back on the show. So I just want to ask you, and I ask this of all of my guests, what do you want people watching the show today to take away?
For me, again, being a psychiatrist, the importance of your mental health. Unfortunately, mental pain often gets dismissed. We are very big and good at like kind of assessing and treating physical pain, but we're not great at addressing and treating mental pain, which is just as destructive to people and their emotional states, their lives, their relationships. So really understanding, like, it's important for you to kind of like be aware of like when you are not doing well. It's nothing to be ashamed about or embarrassed about. We need to get rid of the stigma around mental health and make sure that we are maintaining as best we can a good, healthy well-being for us, so we can live the happy, healthy lives that we're supposed to.
Yeah, absolutely. Well, again, I want to thank my guest, Dr. Ardis Martin, for being on the show today. Dr. Martin, don't you go anywhere. And I want to also give a general reminder to all of you that are tuned in, is to ask that you remember to support our efforts by inquiring about our sponsorship packages, or if you just like to make a donation, become a supporter. And if you're not in the space to become a sponsor, of course, you can still support us, as I said, by making a donation of any amount. Just remember, there is a blessing in giving. Now, again, a reminder, today's show was brought to you in part by the Lemonade Bar, one of our sponsors. I want to ask that you guys be sure and follow me on all my social media platforms and mark your calendars for every Tuesday at 5 p.m. Pacific Standard Time for always another great show with another great guest on You Didn't Get the Memo. If you are in need of some midweek inspiration, be sure and tune into my podcast, Real Talk with Lady G, every Thursday at 6 p.m., 30 minutes, 6 p.m., 6:30 on Spreaker.com. I want to give a quick shout out to all my viewers, all my new viewers, all my donors, all of those of you who have supported me. As I've always said, if you didn't take anything away from today's show, then it's really you who didn't get the memo. Until this time next week, have a great week. Give thanks for all your blessings. Stay safe, mask up, get vaccinated, and always remember to pay it forward. After all, the quality of your life is determined by the decisions that you make. Be well. I'm out.